Okay. All right. Hi, everyone. Thank you for being here. For this discussion, each of us will be sharing an experience from our clinical site. This can be something involving a patient's family member, or even staff interactions. It doesn't have to be perfect or long, maybe just like, small or, story. Just something that was meaningful or, that caught your attention and you still remember. Um, I don't know how graphic you guys want to get, or, just kind of keeping it professional, I guess, like Dr. Steele said, and Dr. Steele, the teacher Steele said. So we can kind of just go over like what do you think you learned from the experience, how you think you handle the situation, what you handle it differently, maybe some of those things to keep like the story short and simple. And then if you guys want to like when somebody tells a story, you guys can be like, oh, I can relate or I can share something that was similar to me. So, does anybody want to go first?
I can go first,
Oh,
or
sorry, go ahead.
Okay.
you want to go?
No, it's up to you.
I'll go first, I guess. I'll get it over with. Okay, so I'm at Lompoc Valley Medical Hospital, and we aren't like a trauma center or anything, so most of what we see are like outpatients and usually like routine exams, which is actually kind of nice for like learning and getting down to the basics of things. But one of the cooler things I've gotten to do so far is spend time in the OR, even on like my first week. They kind of just like threw us in there, and it was kind of like, ooh. But being in the OR is definitely, it feels like a whole different world compared to doing outpatients and like routine exams. The first time being in the OR on my first week of clinicals, it was a little bit overwhelming. It made me feel super nervous. I remember I just felt like I needed to kind of like stay out of the way because like the room was like kind of crowded and there's just like a lot of people in there. I don't know, you have like surgical techs, like you have like rad techs, nurses, surgeons, like it was just all like a little overwhelming for me. But like what really stood out to me was seeing how the C-arm works during surgery and realizing how important it is during the whole process. The surgical team really depends on it, and I thought it was super cool to see how it basically acts as a guide for the surgeon and it gives them real-time images so they can see exactly what they're doing, their procedure, and in a way it kind of like directs everything. At certain points, like the surgeon will be like, they'll stop at the surgery and they'll be like, oh, like we're gonna take a photo, and like they kind of like rely on those just to make sure everything's like lining up perfectly, which is so cool. Um, One experience I do want to talk about though is when I was in the OR. It was one of the first times I did get a little squeamish. It was like a total hip replacement, so it was it was a lot. The whole process, to be honest, like it just really grossed me out. And just like hearing like the tools and like the hammering of everything and like the smell of it, it like really smelled to me like a dentist. I don't know why. I think it was like the drilling. I don't know. Just it really grossed me out. But it was just very invasive and it just like shocked me to kind of like see that in real life. And I think it's pretty normal to feel like overwhelmed and shocked to like see that for the first time. Just like, I don't know, my initial reaction was just kind of like, ooh. But yeah, it was really cool to see how like all like everyone like works together as a team. But yeah.
Erica, that is so cool.
Yeah.
I'm at Cottage and they haven't let us go into the OR like at
Oh,
all.
really? Yeah,
Yeah.
it's really cool. They like kind of like threw us in like first thing, like first week, and I was like, wait, what? I was like, no way. Like, I don't know if I want to do that because I'm like not like a squeamish person, but like just seeing that, I was like, what's going on? It was a lot.
What did you do to kind of like help like not, I don't know, because I feel like if I, at least for the first time, seeing something like kind of like that, like graphic, I feel
No,
like
yeah, I had
it
to
would
like
make me
really
like
like talk
nauseous
myself
or
out of it.
something. Yeah.
I was like, okay, like, because I think my tech kind of knew I was like getting a little grossed out because I was like, ooh, and then I just like kind of like went against the wall for a second. I was like, no, like it was really gross. And then I don't know, I just kind of like talked myself out of it, and I was just like, okay, like this is like what happens every day, like it's fine. But yeah, it was
Okay.
really cool though. I'm like much better now. Like going in, I'm like not as like squeamish, and so it's a lot better.
That's good. That's good. Because I guess we kind of have to get used to it because we're all going to go in there
Oh,
at
for
some
sure,
point,
yeah.
it's going to
I think
be
it
like,
was mainly like the smell of things for me. I was like, why does this smell like a dentist? And then I like realized that they were like drilling in, and I was like, Oh my God. But yeah.
I think with time, right? Like as you keep going, you're gonna get more comfortable. Because
Oh,
I
for
think
sure. Yeah.
Mish too. I'm at a clinic, so I think
Mhm.
it'd be a complete like 360, like might throw up.
Oh yeah, no, it's like so different from doing like outpatients, like just like normal like routine stuff than like going into like the OR and you're like, whoa.
Does anybody else want to share a story?
I can go next.
Sure.
So I am at Cottage, and I think a situation that I can think of, a couple weeks ago, they have us on rotation with like the transportation people, just so that we can kind of get an idea of where everything's at, like in the hospital, and like so we kind of like get a better layout of it. And so everyone that's at Cottage with me, we had like a week to just be with transportation, just like walk around with them. And so there was this instance where we had to transport someone who was in the ICU to like a normal, not normal, but like a different room. And so that meant like, oh, like, like they're getting better, like they're stable enough where they can be in kind of like, a normal room. They don't have to be in the ICU anymore. And so like this patient was an older gentleman, and when we went to go like move him, he was like, "Oh, like I need to talk to my nurse first." And so we got the nurse for them, and I guess, even though it was a good thing that he was moving from the ICU to like a different room, it turned out that he was like really depressed and he felt really isolated. I guess his time in the hospital, like for him, it was just a lot for him to kind of like take in. And so it really just kind of opened my eyes to how hard it can be for some people, to be in the hospital. They might have like a traumatic event, or like they just don't see being in the hospital as something that, not a lot of people like being in the hospital, but I guess some people can take it like really hard. And it's just made me a little bit more aware of how I interact with patients, for X-ray, like, oh, like I need to be careful in what I'm doing and like making sure that they're, comfortable and at ease, just because you don't know what like they're going through. And I feel like that kind of just like stuck with me. So now like the way that I kind of like interact with other patients has kind of changed compared to like at first.
I like that that's kind of your view now, because a lot of people where I'm at VCMC, they feel the same way, and it's not like that all like everywhere. Some people, like in some places, you're just kind of like you're just like a number, right? Like in and out, in and out, in and out. And at VCMC, they kind of stick it to us like treat the patient like if it was a family member, a friend, because that's how you'll stay a good tech, or just like a good, person where, even if it's just like a quick x-ray, like you treated them with respect, you saw them, they were seen, and they're not just like, just a number. So yeah.
Yeah. Yeah, no, I have like a tech that I work with also, and like her patient care is like not the greatest. And like when I work with her, sometimes I'm just like, oh God, like she's like really like it's really bad. And like she'll just like leave her patients, like she's like kind of rude to them. I'm just like, how? I'm like, I don't know if it's because like I'm like a student and I'm like new, but like I love like chatting with my patients and like making them feel comfortable. Like I think everyone should like feel that way. Like it's kind of crazy that some people just like don't have that.
Yeah.
Yeah, especially the way they were talking about how like in the ICU, especially like patients in the ICU when we're at CMH, like we had one yesterday that did like decline care because they're like we don't like the patient did not want to like keep going with care because they just wanted to pass away. And so for all of us students that were like sitting there, it was kind of like what do you do in that situation? And like the speech therapist was there trying to help them because they refused to eat, refused to like do a bunch of stuff, and we're just sitting there and they're like, well, like we can't really do much besides give them comfort. And we're talking to the nurse about it, and we're like, I don't know how you do that. Like that's a lot. And like they're like, yeah, the family understands. And we were just talking, and I was like, that's like unimaginable to be like in that much pain and like doesn't like the patient's like in a vulnerable state, and so we had to like help transport them, and they were like screaming because they were in pain, and it was just super hard to like be there for like 5 minutes. But yeah, transport's it's a lot. So that's like cool at Cottage is like letting you guys do that too.
Yeah, I think even Professor Steele has kind of, I think that made me kind of click where it's, you want to treat everybody like if it was your family member, right? You don't want to disregard them or we're just doing a shoulder, so we're just going to get you in and out, even if you're behind. Because I feel like that's also another major contributing factor is like when you're short-staffed or like for clinics, if you have a lot of patients, you're like, we just got to get them in and out. But I feel like you're not taking in consideration like what the patient might have or what might have caused the patient to come in or what they're going through. So I feel like it just kind of makes you more aware of like considering like, okay, this patient did that. Or even when you take the patient's history, like, oh, what happened to you? Like, for instance, we had a couple weeks back, I was taking a patient's history, coming in for a foot x-ray, I think, and I was just like, oh, okay, so we're doing this, and he started telling me how somebody pushed him off the roof, a coworker. And I was just like, I feel like I stayed in shock. Like even as I was writing the order, like behind like what happened, I was writing it all butchered because like I was in shock that he like actually said like somebody pushed him off. So you just really don't know what a patient's going through.
So what happened? Did you get more of the story or no?
No, because the tech was going to start the procedure.
Oh my
He's
God.
Spanish speaking and I was translating and I was going to get more information. Like that's when he just said like I fell, but then he's like, well, actually, my coworker pushed me off the roof, and I was like, I feel like my face just kind of like went,
Like attempted murder.
Yeah, what the heck?
yeah, the Lord.
Actually wild.
It's sad. It was really sad.
That's
Like I was
sad.
like, oh, I'm sorry that happened to you.
Well, I'm glad we're on the same page about patient care. So, was that your story, Patty, or did you want to go
Oh,
into
I can
your
talk about it.
experience? Yeah.
An experience I had where I feel like I could have been better. So, at the clinic we do special procedures, and we had a procedure that I didn't think would affect me. I mean, this was the first time I heard about it. It's called HSG, hysterogram. I don't know if you guys know what it is, but basically, it's checking for fertility, and the radiologist injects contrast into the cervix with the catheter. And so that day, the tech had warned me, like, some patients do get emotional during these procedures, and others are pretty composed through it. Which was the case for this patient. The patient was not emotional at all. Like, she did fine. We went through the procedure. I could tell she was in some discomfortness, like pain during it. But the tech and the radiologist were asking, like, are you doing okay? Like, checking in on her. But I could tell she was also like in some discomfortness, obviously, right? Nobody wants to be having this procedure done. But I felt in the moment like I wanted to check in on her and I didn't. I feel like I held myself back. Like I didn't know my place between the technologist and the radiologist. But I feel like through the day, as after the procedure went home, like over, like I went home thinking about it. Like I feel like I could have done better. I could have been more um, empathetic to the patient or been more comforting. I didn't think it would have affected me the way it did. Like my tech explained it to me, but I just felt bad. I think also a contributing factor was that I went to go get the patient and she was alone. Like nobody came in with her. She was just alone. So I feel like that also kind of like, I was like, oh no, like I felt bad that the patient was going through this. But I feel like I could have been better, like been more comforting to the patient, checked in on her. But I feel like now for future, because it is a common procedure at my clinic, like it'll prepare me because what if my patient in the future is not as composed as her, right? Like my patient could be emotional. Like I want to know what to do. So I feel like now I'm kind of taking those steps into being more comforting to the patient and checking in on her in case that does happen. I want to be more aware and not hold back, like be there for the patient.
I think that's really good that like you recognized it though. Like, I mean, and like don't even beat yourself up over it because like we are students and like we're learning so much. Like, but I think that's like really good that you like even like acknowledge that, you know?
Yeah.
Yeah, I didn't think
You
it
don't
would
know what
affect me.
place
I
you
mean, she
are.
explained it.
Yeah.
I think as a student, we just kind of go in this like area where we're just like especially if it takes a text taking over.
Mhm.
And, and sometimes you're like, should I talk? Should I not talk? Should I say something like, what is too much? Like, what is too much? Cause sometimes like with me, I'll just be like, and what happened? Oh my God, that sucks. But what did you do? Like, I'll just, because, I've been in the medical field forever and I think like talking to a patient always kind of helps the situation. But I can, relate to Patty because there's been a lot of instances, especially in floral, where I'm just kind of like in the corner and I'm like, I'm not going to say anything. So it's just, I can totally see that happening, Patty, but I'm glad you acknowledged it too.
Yeah, it totally felt like how you said, like I was in the corner, but I could see her like, but the tech was checking in on her too, but I felt like I could have done it. I just didn't say it.
Yeah, but like also like the patient's like in a vulnerable spot too. So it's like I'm glad like you were also observing like the patient's emotions and reactions during it, because like that'll make you a better tech and a student, like going into like getting like future competencies and flora, like when you're by yourself, like not completely by yourself, but like you're being the tech, and it'll make you like a better tech because you're already observing like, and it's like a very vulnerable exam, so you're already witnessing her emotions. And like at our clinic or at the hospital, the doctors will tell them sometimes like the results of the histro. So it's like in those positions too, like you have to be aware of like how to react. So I'm glad like you're already showing that patient care route.
Yeah, definitely
Sure.
tricky situation trying to read the patient in the room as
Read the
well.
room. Does anybody else want to go?
I'll go.
Okay.
So I'm at CMH, and I think it was 2 weeks ago. It was like all of like the students in our class. It was there's four of us, and we were in the ER together, talking to the techs about like how to be better at exams when CT is like in the same area as us and we can see CT happening. And they had a patient code after the exam, and it was like all of them, even like the tech, like the radiology techs behind us, like ran in there to help. And us students just sat there because we were like, what do we do in that position as a student? And it was like one of the scariest things because like I've never seen a patient code or someone I know code. And so we were all sitting there like watching how they take over a room. Like there's like 30 people that come in from the hospital. They're like performing CPR. They're trying to wake up the patient. Like the CT techs are in there, like trying to undo the IVs. And there's our radiology techs that are like in there trying to figure out what's going on. And like, there's like doctors and everyone in there. And like, I'm like in shock. Like my heart's like racing. I'm like, oh my God, like someone's like not responding, and they're like trying to call the patient's name. And like in that position, we were all like, we know how to do CPR, but it's like, what do we do in that situation? Because it's like we're also being vulnerable and being like, we're only fresh 4 months into our program, and we're like, how do we like respond to those situations if it was us? So like, we were like talking to techs, like there were some techs with us obviously to make sure we were supervised, and they were like, we're like, what do we do? Like if that happens to us? And they were like talking to us about it. And it's just like every time, like now I go into like a room, like the ICU, I'm like super mindful of like they're in a position of being vulnerable. Like a lot of techs have told us, oh yeah, like a patient will code during mid-exam in the ICU, and they're like, you have to be prepared to like step back and let people take over and not be afraid to like either help or step away so you don't like do anything because like they have like all the tubes and the IVs, so we're like they always tell us like don't touch the tubes, whatever you do when we're in there. So like we're always mindful, but yeah, seeing a patient code for the first time was definitely an experience that like it's like always in my head now, that I'm like aware of like where the buttons are, where the closest like crash cart is, because like we have to know. But yeah, that, and then probably like text talking about patients dying, and like some of them are like, oh yeah, like they're like not showing any signs of improvement. And I'm like, how do you like, I'm like, I can't even talk about that. Like, I don't know how some of them, like, I think they're so immune to it though, that like when I'm walking in there, like to take a chest portable on like an ICU patient, I'm just like, I don't want to touch them because they're so fragile in a state that I'm like, I don't want to ruin anything, but they're like lifting them up and shoving the plate. And I'm like, oh my God, like be careful. Like they're like, be gentle.
We're over
But
here like barely moving him,
they
walking on
just
our feet.
howl.
There's a bunch of cords.
Yeah,
Like,
just like,
I'm so gentle too. I'm like, okay, I'm just gonna roll you over.
yeah, it's just like in such a position that we're like, and especially I'm just like, sometimes I can't even like, lift that much. So they're like taking the brunt for me. And I'm just like, oh my God, like please don't pull. Like I'm like, please don't pull an IV, Kylie. Please don't, like be careful. But yeah, just being like mindful that like our position and our like as a student, like we witness like life and we witness death and we witness all these things and like people coming in maybe for like a finger x-ray and then we go take one for like a respirator to see if like the tube's in the right place, like they're being trached and we want to see. So it's like we're always in a position that I'm just like, okay, I need to have my composure and I need to watch how the techs handle the situation. So I think that's just been what I've learned and that, yeah, ever since that patient coded in CT, I've been like very aware of my surroundings, especially in the hospital.
yeah, I can totally relate because that was going to be my kind of like, I have a similar story from my clinical experience. You know, as with part of the healthcare field, although we're not like nurses or doctors, I think, you know, we do have a big part in, you know, the healthcare field because, you know, when a trauma comes or something, we're at the front end lines. So I think that, you know, has its pros and cons that, you know, the pros is that, you know, we get to just do the x-ray and leave, you know, and not, you know, maybe work on people who are having, you know, end of life. I had the situation where, last week, the guy just came in dead. So it was a motorcycle, or a car accident where I guess he got hit by a semi. And the vibe was just so quiet. And I thought it was weird because, you know, they called trauma too. So, I was in the ER that day. And nobody was talking. Like it was quiet. So we waited for him, well, for them. And then they came in and, you know, he was all bloody, but it was like quiet. Like they were working on him, but it was so quiet. And then I'm just kind of waiting there. And then as soon as everyone starts just within 5 minutes, everyone just starts taking off their PPE. And then he's like, okay, let's go. And I was like, oh, we're not going to do x-ray. He's like, oh no, he's dead. And I was like, oh, and I got so sad. I was like, oh my goodness. Like, because I'm not going to try to, you know, like they've been working on him since like the ambulance. So now they had like the automatic, AED on him. So like I didn't realize that what was on him. It was like pumping for them because I guess they were all just tired of pumping on the way over here. So I guess when it's a certain situation where he doesn't even have like a chance to live, they just don't go to the extremities to work on them. But I just thought, I was like, wow, that's somebody's like kid or dad or, you know, cousin or, you know, and I'm like, it could be anybody we know. So it just kind of gave me this, sorry, I have my kid today. It didn't work out for me. Yeah, you can play. And so I had to have him here. It's crazy. So for me, it was just like, okay, so I'm going to start to see that because I haven't seen that. I've seen like motorcycle, accidents and like, or car crash, but they're living, right? So I think for me that opened my eyes up to be like, okay, so you're going to see more of that. And it's, you think like, I think we see it because we're new, like everyone's kind of immune to it, but it's still sad. You know, I think it's at the end of the day, it's still sad. And yeah, that was just kind of my experience that kind of stuck out to me. I haven't really had any, I talked to a lot of, you know, patients, but nothing stuck out to me like that patient did. And yeah, it's just, you know, one of those cons that you see as an x-ray tech, but yeah, that was me.
I forgot that at VCMC, VCMC, you see more of the
Trauma.
because you guys are tier 1. We're because
Yeah.
we're tier 2. So we always hear the ambulances going to your guys'.
Oh, yeah.
Yeah, so
Yeah.
I was like, that's crazy that you guys, because we never see those, so it's very interesting that that's
I think
crazy.
just said we have 10 minutes or our freeze and a pop out. So okay. It just gave me a little thing. Well, I think all of our experiences are kind of like intertwined with what we're going through, and I think that just as new techs, we're gonna see a lot more, whether it's good or bad. And I'm glad we're in this together, and I hope we become good techs.
I hope
I'm
the
gonna
same.
that what?
I said I hope the same for all of us.
Yeah.
Building that, not being. I don't think the techs are like immune to it. I think they've just developed their way of coping with it, and I think maybe we will get there too. But like you said, we're still new,
And
so
they know what they're
everything's just
doing.
so like.
I'm like, I want to be like them. They know exactly what to do.
Yeah.
I'm like, okay, I'm gonna pause the recording here.
Okay.
What do I do? Pause.